Heart disease claims a woman's life every 80 seconds, if you can believe that. It's also considered the greatest killer among us. It's the American Heart Association's Go Red for Women Day, and Dr. Kohli joins us live wearing red, of course, even on her ears. Happy Heart Month, Dr. Kohli.
Hey, Doc.
Happy Heart Month, guys. You look amazing. Red is my favorite color, if you hadn't guessed that.
Yes, she's got a red car. She's a cardiologist. How do women...
Want to tell anybody else ways to find Dr. Kohli?
What? A cardiologist?
Her social security. License plate starts with X.
There's a lot of red cars out there. Okay. Sorry, Dr. Kohli. Let's talk about this because this is so important and you have so much great information for us. It could save lives. How do women know if we are suffering from a heart attack? I hear that our symptoms are different than men's.
Ladies, our symptoms are different, and it's really important for us to take some time today to talk to a woman in our life, our mom, our wife, our sister, our daughter, about how those symptoms might be different. Because we have traditionally thought of heart attacks as chest pain, arm pain, just like we saw Mr. Big on Sex and the City grab his left arm and fall over. But that's not how women feel heart attack pain. We feel it differently. So we could feel atypical symptoms like nausea, heartburn, fatigue, back pain, shortness of breath. So we have to keep our radar up for that. We also know that heart disease in women is different because it involves the small arteries or the side roads rather than the big highways like heart disease in men.
I didn't know that.
Yeah, me neither.
I really didn't know that at all.
And I don't like getting tips necessarily because if I'm out of breath and all of a sudden my back hurts, I'm like, oh my God, am I a woman having a heart attack? You know, like as soon as I hear something like that, it goes in my head. All right, so because of all this, in the medical community, are women treated differently than men for this specifically?
They really are. And the problem is we have all this science, all of the clinical evidence that we have is based on studies done in men, and we're applying it to women. And we know that women have atypical symptoms like we discussed, so they don't pick it up. They present later. The medical team doesn't pick it up, so they actually get fewer diagnostic tests. And even after they're diagnosed with heart disease, Jeff, they end up getting less aggressive treatments. They get less medications. They get less surgery. So this is really a systematic system-wide problem with gender discrimination essentially occurring when it comes to heart disease. And we all need to work harder to educate each other and try to close that gap.
That's what we're doing today to hope to pass on. So what risk factors are specific to women? I think of like if you're obese or a smoker, are there other ones for women?
Well, obesity, smoking, high triglycerides actually confer higher risk in women than they do in men. So not only do we have more burden from the traditional risk factors, ladies, we also have some very specific risk factors that only happen to us because we're designed to get pregnant, right? So pregnancy is thought to be the first stress test that a woman ever has, essentially. And some women fail that stress test. So the hormonal changes that come with pregnancy can cause, cardiomyopathy or weakening of the heart muscle. They can cause high blood pressure. They can cause diabetes. So anything related to our hormones, whether it's pregnancy, when we go into menopause, whether we get hormone replacement therapy, all of those are risk factors for us.
But aren't our hearts stronger?
Oh, yes, they better be.
Yes, they are stronger. And
way to let them bully you into an answer.
No, guys, I mean that in a scientific sense. Now, emotionally, personally, I think we're a little stronger too. So I think we're more resilient from an emotional perspective. But the science does tell us that women actually have hearts that are designed, again, to carry the burden of pregnancy, which is a stress test. So in a way, we're physiologically stronger. And that actually was proven by a woman who swam across the English Channel, which is obviously a very intense cardiovascular activity. And she was able to do it compared to no other man.
Yeah, so. And it's also freezing. I can't believe she did that.
It was a hard
wetsuit.
It was a hard swim.
Cold water. Anyway, all right. I will not be doing that.
Me either.
Why would you do that? Get a boat. It is Black History Month, obviously, Doc. Now, what should African-American patients be aware of when it comes to heart disease? And is there something that we should be asking our doctors or extra tests or like what should we do?
Al, Black American patients actually have a 30% higher risk of dying from heart disease than white Americans. So it is time for every Black person to approach their doctor and talk about how they can minimize that risk. They have risk factors that present earlier in life. Their risk factors are more aggressive, like hypertension that requires more medications to treat. And I think this is a social problem too. They have less access to care. They have less access to medications. more food desert. There's just so many social issues that I think that they can also bring up with their physicians. But it's important for us to know this in order to address it.
Wow. Well, knowledge is power. Thank you so much, Dr. Kohli. We appreciate you. For more about the American Heart Association's Go Red campaign, visit goredforwomen.org. Thank you, Dr. Kohli. Have a great weekend.
Thanks, Doc.